Let's talk about healthcare. This morning I got an email from an interview by Mark Levin by a call-in. A guy's name is Jeff from Chicago. Jeff is a brain surgeon, and they were talking about how the government doesn't even know how to make something like a pencil. And he said, I just attended a meeting in Washington, D.C. on what brain surgeons can look forward to in the coming year if Obamacare doesn't get repealed. He said patients are going to be considered units. He said they're not called patients. And he said anyone over 70 years old is not going to be receiving brain surgery because these units are no longer classified as productive citizens. They're beyond an age that the government considers valuable. And he said government bureaucrats will determine who gets care and who doesn't. He said, but at 2 in the morning, if I get a 70-year-old person who has a stroke or has a bleed in the brain, I have to somehow get a committee from the government to determine whether I can provide care for that patient. And Mark Levin said, where is this written? He said, is it written for the public to read? He says, no. He said, this is inside information that they provided with brain surgeons in Washington, D.C. on what the future holds in healthcare. And this is just what they call units of care that the government will allow because expensive conditions like brain surgery or heart conditions or cancer will no longer be allowed. And in Great Britain, thousands of doctors protested because the government of Great Britain, which is the largest employer in the world, 50 million people, the government decided cancer was too expensive to treat. And so the government security that was promised is a myth. And this is inside information, which is something to think about. What kind of country do you want to live in? We're all going to die, according to research. 1 out of 1 of us is going to die. But would you rather decide when and how that happens? Or would you rather leave that information and that decision to nameless, faceless, heartless bureaucrats? And that's something to think about.